Hello and welcome. In this video, we'll go through complete OET test format. The video is designed to help you understand how OET is structured, what skills are necessary, and what you should expect before you begin the preparation. Let's begin by understanding what OET is. Occupational English Test. It is an English language test specifically designed for healthcare professionals. Unlike general English tests, OET focuses on real workplace communication used in healthcare settings, which makes it highly relevant for professional practice. OET acts as a proof of your ability to communicate effectively in any demanding healthcare environment. That's why it's mostly accepted for professional registration, visa applications, and employment processes. There are multiple versions of this test, like nursing, medicine, occupational therapy, optometry, pharmacy, physiotherapy, dentist, and many more. While the profession may differ, the overall test structure remains the same. OET assesses four key language skills: listening, reading, writing, and speaking. Candidates receive the score on the scale of 0 to 500, which is graded between A to E. Most of the regulatory bodies specify a required grade or score in each subtest. So it's important to meet criteria in all four skills. There is nothing like overall bench score. Okay, you need to score the required grade in each subtest. Now, OET is delivered through three modes: paper-based, computer-based, and OET at home. With this understanding of test delivery and scoring, let's now look at structure of all four subtests bit in detail, starting with listening subtest. Listening has three parts, part A, B, and C. All together takes 40 minutes, and you cover 42 questions. In listening part A, you'll hear two different recordings of a healthcare professional talking to a patient. You'll be given 30 seconds to read the patient details and the consultation context. You'll read all 12 blanks and then the audio is played. You write answers simultaneously exactly as you listen. Your answers will be a word or a short phrase. The process continues for extract 2. This part assesses your note-taking ability. I hope it's clear. Now, let's see listening part B. In listening part B, you'll hear 6 different extracts. You have 6 MCQs with 3 answer options, and you have 1 extract per question. You'll first listen the context statement. For instance, you hear a nurse giving instructions to a patient before discharge. You'll then have 15 seconds to read the question and 3 answer options. After 15 seconds, the audio is played and you select answer A, B, or C within a few seconds. The process continues for all 6 questions. This part assesses your ability to understand gist, purpose, attitude, specific information, and course of action. Now, let's look at listening part C. In this part, you will have 2 long extracts. Before each extract, you'll have a context statement. Like in this case, you hear a physiotherapist called Dr. Neha Rao giving a presentation in which she discusses treating a patient with chronic lower back pain. You then have 90 seconds to read 6 questions with 3 answer options. Then the recording is played and you keep on giving answers one by one till the 6th question. Then the audio guides you to switch to the extract 2 and the process continues. If you are taking paper-based test, you'll have 2 minutes at the end of the audio to check your answers in part A, B, or C. But if you are taking computer-based test, this part is divided. You have 20 seconds after each extract of part A. Then you have another 20 seconds after whole part B. And then you have 20 seconds after each extract of part C. So this is how you can check your answers on computer-based test. I hope you are clear about listening subtest. Now let us see the structure of reading subtest. Reading subtest has three parts, part A, B and C. But here the time management is important. You'll be given first reading part A only that you need to complete within 15 minutes. After 15 minutes, the part A will be taken back from you and you will be assigned part B and C that you need to cover in 45 minutes. So while working, you come across the situations where you need to go through important information quickly and record it accurately. So exactly the scheming and scanning skills are assessed in part A. You have four short texts A, B, C, and D, and you have three types of questions. You have matching the text, that means you will be given the list of questions or the information, and you need to decide that the information comes from which text A, B, C, or D, and your answer will be any one of them. Then you have short answer questions or sentence completion. So for this, you just search the answers, you scan and identify the answers and write it accurately in a word or a short phrase. There are total 20 questions and 15 minutes. Does it sound challenging? But it's not, believe me. It's one of the scoring parts. All right. So after 15 minutes, part is taken back from you. Then you will be given B and C together. Total questions in part B and C are 22 and you are assigned 45 minutes. So you can spend ideally 2 minutes per question. Let's see reading part B. Now, while at work, you read emails, hospital policy, notices, memo. So this kind of practical communication is written in reading part B. You have total 6 questions with 3 answer options. As you can see on the screen, you will get a question, 3 answer options, and the text. And the text is about 115 words. So small text is given. You need to find the answers for this particular question from the given text and you need to select A, B or C. And you have such 6 questions in reading part B. Then in reading part C, you have two separate texts. Two separate texts and you have 8 questions per text. 8 questions with 4 answer options per text. So in reading part C, you have 8 plus 8, total 16 questions. But don't worry, because most of the questions tell you where the answer is. Okay, the questions are designed like what does the writer suggest about something in paragraph 1? So you know where to find the answer and what you are looking for. So there are no chances that you are getting lost. All the answers are always in sequence. Okay, so you need to find the correct answer. You need to interpret. Okay, and a lot of things you are doing in reading part C. The language complexity of reading part C is little higher than part A and B. This part assesses your ability to identify attitude and opinions, purpose, overall argument, implied meaning, complex vocabulary, and references within the text. Might sound challenging, but it's really not. Okay, with practice and dedication, you can score high even in reading part C. At the end of 45 minutes, you do not have any separate time to check your answers. You do not have separate answer sheet to transform your answers. All the answers will be written into the question paper itself. Okay, in the paper-based version. On computer-based version, you are selecting the answers. For part A, you are typing on computer-based test. On paper-based test, you are writing your answers. That's the only difference. All right. Now, before I move to writing subtest, I would like to make it clear that reading and listening subtests are same for all 12 versions of the test. Okay, if you're a nurse, doctor, pharmacist, physiotherapist, dentist, optometry, veterinary scientist, whosoever you are, the listening and reading tests will remain the same. However, the writing and speaking are profession specific. Let's have a look. In writing subtest, you will write only one task, and that is letter writing. It's a formal letter. You will be writing as a healthcare professional, so definitely the letters will be the formal one. There are total 45 minutes in total. Initial 5 minutes are to read only, and in next 45 minutes you can write and complete your letter. You will be asked any one type of letter. It can be referral, transfer, discharge, or advice letter. You will be given a case note followed by writing task. Let's have a look at this example. You will be given case notes like this, which contains patient's details, all the details about the patient, and the writing task helps you to understand what type of letter you are going to write, to whom you are going to write, and why you are going to write the letter. So, based on reader and purpose of writing a letter, you will select the relevant information, and based on your selected information, you will create a beautiful formal letter. That's it, only one task in writing subtest. The length of the letter should be approximately 180 to 200 words. All right, that's all about writing subtest. Now, let's have a look at last subtest, and that is speaking. As I said, speaking is also profession specific. There will be simulated consultation between a patient or a healthcare practitioner. As a candidate, you take your professional role as a nurse, doctor, pharmacist, or whatever you are. An interlocutor takes the role of a patient or carer. Okay, the test begins with the ID check. So make sure you have a valid ID, your passport or national ID. Make sure before registration that it does not have any nearby expiration date. So the interlocutor will make sure that you are the same person who has registered for the test. Then there will be the warm-up session. Warm-up session is designed to make you comfortable with the interlocutor because many students fail the test not because of their English or because of lack of understanding, but just because of exam anxiety. And OET has brilliantly designed this part as a warm-up session to help you to get used to with the environment and with the person with whom you are going to talk, right? So in warm-up session, they ask you very common questions about you, your profession, and your professional goals. After warm-up session, you complete 2 role plays. Before each role play, you will have 3 minutes of preparation time and then you speak for 5 minutes. Let me help you to have a look at the role play card. Role play card looks something like this. Here you will have the candidate card number. Here you will see your profession, setting, okay, where you are right now, what kind of patient you have been assigned, and your tasks. So you will read this information, and if you have a doubt or a question about the task, you are free to ask your interlocutor. Isn't it amazing? Yes? Yeah. So you can ask questions during your preparation time to your interlocutor. And then when the interlocutor tells you to begin, you have to start as a healthcare professional, and then you continue it for 5 minutes. Okay. And then after the end of 5 minutes, the interlocutor will take the card back from you and then you will be given another role play card. Again, you are preparing for 3 minutes and communicating for 5 minutes. And then you will have the best line you will be waiting for on that day, and that this is the end of OET test. Isn't it? Yeah. So now this brings us to the end of OET test format. If you know the structure of each subtest, your preparation becomes more focused and effective. If you still have any doubt or if you need any kind of support for your OET preparation, you can contact me. The contact details are displayed on the screen. I wish you all the best for your preparation.